Have you noticed lately how often mental well-being just pops up
Oh,
in
definitely.
conversations, news, everywhere, really?
Yeah.
It really feels like we're, finally talking about something super important, something that touches all of us.
It does feel different now, more open.
And it's not just talk, right? There's this huge economic shift happening behind the scenes, a real surge.
Hmm.
And that's what we're diving into today, the global behavioral health market.
Right.
And when we say behavioral health, just to be clear, we mean solutions, services for mental well-being, stress, emotional health.
And even things like addiction, eating disorders, that whole spectrum.
Exactly. So our mission here is really to unpack the big trends, the projections, and, what's driving this massive global market.
Give you the key insights fast.
Yeah, help you get a quick grasp. And importantly, all our insights today are pulled straight from comprehensive data provided by Cognitive Market Research.
Solid data.
Okay, let's try and get a sense of the scale
That's
here.
pretty staggering.
Right. So back in 2021, this market is already pretty big, valued at just over $61.5 billion. dollars.
61.5 billion. Already substantial.
But here's the really eye-opening part. By 2033, the projection is, well, it's set to more than double.
Double. Wow.
Yeah, soaring to nearly $148 billion.
148 billion. That's huge.
It is, and that means an average growth rate of over 7.5% every single year.
Which is, pace you don't often see, especially in established sectors. It really signals something profound is changing.
So what is driving that? What's behind this incredible growth?
Well, what's really fascinating, the core insight, I think, it isn't just that we're talking more about mental health.
Really?
It's more fundamental. It's like a societal revaluation.
Yeah.
We're shifting it away from being this siloed personal problem.
Right, something you deal with alone.
Exactly. Towards seeing it as a recognized public health priority.
Hmm.
And that widespread acknowledgement, that's a huge driver.
Okay, that makes sense.
And then you layer on top significant advancements in treatments.
Like what kinds of advancements?
Well, things like new personalized cognitive behavioral therapies, for example,
Hmm.
and also a lot of innovation happening in digital therapeutics.
Digital therapeutics. Can you maybe unpack that a little for listeners who aren't familiar?
Oh, sure. Absolutely. So digital therapeutics, you can think of them as evidence-based software programs
Right.
or apps.
Right, apps.
But the key is evidence-based. They actually deliver therapeutic interventions directly to the user.
Okay.
And the real insight there is how they're fundamentally changing how and where people get care.
Moving beyond just the clinic walls.
Precisely. It empowers people to manage their well-being, right from their phone or their computer.
Hmm.
And you combine that with this growing global demand for care that's accessible and also affordable.
Yeah. Access and cost are huge barriers.
They are. And digital helps tackle both. So put it all together, and it really ignites the market growth. So the big question this kind of rapid expansion raises is, what does this all mean for our global commitment to behavioral health, both economically and socially, when it becomes such a major industry?
Yeah, it's a powerful question. I have to admit, when I first looked at these numbers, the sheer speed of it really struck me. This expansion, nearly tripling in, just over a decade?
Yeah, 2021 to 2033.
It really underscores this global pivot. And, while North America and Europe are still like foundational pillars,
Established markets, yeah.
right, for development and investment. But what's really surging, the fastest growing region by far, is Asia Pacific.
That's a key finding. The growth there is really accelerating.
So if we connect this back to the bigger picture.
Yeah, this kind of growth, it's not just market mechanics, right? It reflects these deeper societal shifts we've been talking about.
Okay.
It's consistently fueled by those core drivers, like the awareness campaigns. They're genuinely destigmatizing mental health.
Making it okay to talk about, okay to seek help.
Exactly. Then there's crucial government support, policies that are actually integrating mental wellness into primary health care.
Yeah.
That's massive.
Integrating it. So not just a separate thing.
Right. Making it part of routine care.
Right.
And as we touched on, that transformative power of digital services, just breaking down those old barriers to access.
Access, cost, stigma. Digital helps with all three.
It really does. And it's the convergence, how all these different factors are coming together. That's what's really pushing this market forward everywhere.
So let's bring it back to the listener. Why do these figures, these trends, why do they matter to you?
Great question. Because they really do impact everyone. If you're, say, a policymaker, This data highlights just how urgent it is to build mental health infrastructure systemically.
Right, it's not a side issue anymore.
Not at all. If you're an investor, well, it clearly signals ripe opportunities, not just in, traditional clinics, but maybe especially in those digital platforms, preventative care models.
New areas opening up.
Definitely. And for healthcare professionals, it's a clear call to adapt, to embrace new ways of delivering care, focus on more holistic approaches.
Holistic, meaning mind and body together.
Exactly. So you see, this isn't really just about market numbers in a report. It's about a profound societal shift, valuing mental health finally on par with physical health.
Which brings us to sort of the big takeaway, maybe. What does this all mean for us going forward?
Mhm.
This deep dive really paints a picture of a world where mental and behavioral health are becoming like front and center in healthcare.
Moving beyond just awareness.
Yeah, way beyond awareness campaigns. It's becoming a thriving global industry.
A major economic force.
So maybe the thought to leave people with is, as we move forward, how might this huge widespread investment truly redefine what holistic health means, for all of us?
Right. In our communities,
In our workplaces.
our personal lives.
Yeah, it really makes you think, doesn't it, about a future where well-being isn't just something we hope for personally, but it's actually a foundational, flourishing global endeavor. Really changes the landscape. Welcome to the deep dive. In a world just overflowing with data, our goal here is always to cut through that noise and bring you what really matters. Have you ever stopped to think about the huge shifts happening globally in mental well-being and the whole system that's built up around supporting it? Today, we're diving into something really crucial: the constantly changing world of the behavioral health market. And look, this isn't just about stats or figures. It's really about understanding a key part of our health journey collectively, individually. It touches so many lives, right? And it shapes how we even think about well-being.
Exactly. And our mission for this discussion is just that, to pull out the most vital insights from some recent, pretty comprehensive market research. We're really focusing in on, what's driving growth in behavioral health, what are the big obstacles it's still up against, and maybe most excitingly, what new trends are reshaping its future. Honestly, getting a handle on this market, it's a great shortcut to being properly informed on a topic that's, well, it's super relevant and pretty personal for almost everyone.
Yeah, absolutely. And the insights we're using today, they come straight from a big market research report. So it gives us a really authoritative look at global mental health care. It's kind of like getting a peek behind the curtain, at all the forces shaping things. Okay, so let's jump right in. The first major takeaway from the report is this undeniable surge in demand for mental health services. It almost feels overwhelming, doesn't it? What's really driving this? What factors are behind this huge increase in the need for support? Well, what's really striking, I think, is just the speed of it all, the sheer velocity of this surge. The report points to a really rapid, widespread increase in things like depression, anxiety, substance abuse, stress-related issues all across the globe. We're talking about a pretty significant percentage jump in reported symptoms just in the last few years. It directly mirrors the long shadow of things like the pandemic, obviously, ongoing economic pressures, and also just, frankly, a much higher general awareness about mental health now. So it's not just people talking more, though that's part of it. It's a deep, measurable shift in actual clinical need. You see it across all age groups.
That measurable shift.
Yeah.
And the conversation changing, that's huge. It must be leading more people to actually seek help. But okay, beyond just individual awareness, are there bigger, systemic things pushing the market forward too? Oh, definitely. Yeah. If you connect this to the bigger picture, strong support from governments and insurance programs, that's another really key driver. We're seeing more mental health parity laws being enacted, and significant expansions in insurance coverage, both public and private. That genuinely makes it easier for people to actually access care when they need it. Governments worldwide are putting in substantial investment too, funding clinics, launching awareness campaigns. It's all aimed at improving access, especially in places that have been underserved or maybe economically challenged. And the insight here isn't just that they're investing, but where it's making a difference. For instance, the report mentions in some regions specific government funding for early intervention in schools. It's shown a measurable drop in adolescent crisis situations. That really proves the preventative power of these kinds of initiatives.
That's a clear win. For accessibility, definitely. And it sounds like it's not just siloed mental health services anymore either. Is behavioral health becoming more integrated, like right into primary care?
Yes, that's a really critical development. Spot on. Medical institutions are increasingly taking a truly holistic approach. By actually embedding mental health services right within their standard care pathways, they're not only boosting patient outcomes,
Hmm.
but they're also doing a lot to normalize the whole process of seeking psychological help, making it less of a separate, maybe stigmatized thing. It's a big step towards patient-centered care that really gets the mind and body are linked inextricably.
Okay, so we've got this rising demand, these strong drivers pushing things forward, but I mean, it can't all be smooth sailing, can it? What are some of the biggest roadblocks this market is still hitting?
Right, that does raise the question, where are the bottlenecks? A key restraint the research really highlights is the global shortage of qualified mental health professionals. Whether you're talking psychiatrists, therapists, clinical psychologists, the demand just massively outstrips the supply. And this is particularly bad in rural areas or economically disadvantaged regions. It leads to these incredibly frustratingly long wait times, delays in getting critical treatment, and just immense pressure on the professionals who are there. It's a fundamental supply-demand problem.
Wow, that bottleneck sounds like a nightmare for patients trying to get help. So even with more awareness and funding, if there aren't enough people, it's still a real struggle. What about the human element, the stigma? Is that still casting a long shadow over things?
Unfortunately, yes, it really is. Despite all the progress we've made in awareness, stigma, and these cultural barriers around seeking mental health treatment, they remain a really persistent challenge. A lot of individuals still hesitate. They hold back from seeking help because of societal judgment, maybe cultural norms that discourage it, or just fear of discrimination. The report details how this gets worse because of a lack of mental health literacy, especially maybe in developing countries or more traditional communities where mental illness might not even be sort of acknowledged as a health issue. It's deeply ingrained.
Right. And even when people do manage to seek help, is the system itself always easy to navigate? I've heard people talk about fragmentation being a real issue.
You're absolutely right to bring that up. Fragmentation within the care systems themselves, that significantly holds back the market's potential. What happens is behavioral health services often operate in these silos, right? Across different providers, different
Yeah.
clinics. And that leads to poor data sharing, inconsistent care plans. Without integrated platforms, without shared patient histories, the continuity of care just suffers. It reduces how effective treatment can be and really limits proper follow-up. It's like trying to build something complex, but all the pieces are disconnected.
Okay, so we've got the picture. Surging demand, strong drivers pushing forward, but also these very real frustrating challenges like workforce and stigma and fragmentation. Now, this next part seems really interesting, uncovering some truly innovative approaches, things that could really redefine mental health care. What are the exciting new trends starting to maybe revolutionize the behavioral health market?
Yeah, this is where it gets quite optimistic, actually. One of the most transformative trends, undoubtedly, is the meteoric rise of digital therapeutics and telebehavioral health. We're seeing everything from really sophisticated mobile therapy apps to AI-powered mood tracking tools and just widespread adoption of virtual consultations. Technology is making mental health care more accessible, definitely more cost-effective in many cases, and crucially, more stigma-free for some people. This digital boom is especially helpful for, say, younger users who are digital natives anyway, remote populations, obviously, and also individuals who just prefer the anonymity that virtual platforms can offer. It's dramatically widening the net of who can get care.
That makes perfect sense, especially like you said, for younger generations who are so comfortable with tech already. Speaking of younger generations, is there a specific focus emerging on youth mental health, particularly with these new digital tools available?
Absolutely. Yeah, that's another really compelling trend the report highlights. This growing focus on youth and adolescent mental health. Look, today's younger generations, they face unprecedented pressures, right? From intense academic competition to just constant social media exposure. And that is unfortunately prompting earlier onset of mental health issues in some cases. So governments, schools, health organizations that responding. They're developing tailored programs like school-based counseling, dedicated adolescent helplines, specific interventions aimed at catching things early and promoting long-term wellness. It's a real proactive shift, focusing on that foundational mental health.
That feels like a really hopeful sign, catching potential issues earlier on. And what about the care itself? Is it becoming less one size fits all, more tailored?
Precisely. Yeah, the market is really starting to embrace personalized and measurement-based care models. Providers are increasingly using sophisticated data analytics, using patient-reported outcomes to genuinely tailor treatment plans to the individual. And with digital tools now able to track progress, maybe even help adjust therapy in near real time, patients are getting more effective, more targeted interventions. This is driving demonstrably better mental health results in many cases. And it also reinforces accountability across the whole treatment journey. It's about moving away from guesswork towards, well, precision care.
So wrapping this up, what does this all mean for us? As we finish this exploration, it's just so clear the behavioral health market isn't static at all. It's really in this pivotal phase of rapid change.
Yeah, to sort of synthesize the key takeaways, you've got this powerful mix, right? Expanding public awareness, meeting robust tech innovation like telebehavioral health, AI tools, plus increasing support from governments and institutions. These forces, they're all working together, collectively pushing the sector forward and positioning it, hopefully, to better meet the growing mental health needs we see across the global population.
It really does feel like mental health is shifting, doesn't it? Moving out of the shadows, maybe, becoming a more open conversation, something more integrated into just everyday life.
It does, and that raises a really important question maybe for you, the listener, to think about. Given this ongoing evolution, more access through tech, more personalized care, what new responsibilities might individuals or even communities have? Responsibilities in actually fostering and maintaining mental wellness beyond just seeking professional help when things get tough. How can understanding these market shifts maybe empower you to advocate for better mental health outcomes? Perhaps in your own circles, your family, your community.
Some powerful thoughts to leave you with there. We really hope this deep dive has given you a clearer picture of this incredibly vital and rapidly evolving market. Keep exploring, keep asking questions, and definitely keep that informed curiosity alive.